get started off by doing 20 seconds of hand hygiene. Hello, my name is Sean and I'm going to be your nurse today. I'm going to go ahead and just first off congratulate you on the delivery of your baby. I'm also going to go and do a quick head to toe assessment, okay? We'll go ahead and get some gloves on. How are you doing today? You're tired? Yeah, I imagine. Delivery's hard, yeah. So first off, I'm just going to go ahead and unswaddle your baby. You can kind of see that he's resting peacefully right now. I'm going to check her ID band or his ID band and make sure it matches the records, and it does. So I also see from the chart that she was born today, approximately 12 hours ago, vaginally and at 40 weeks gestational age, and his APGAR score was 9 at 1 minute and 9 at 5 minutes. I'm also going to take some vitals. The heart rate is 120, the respiratory rate is 40 breaths per minute, and the temperature is 98. He's also pink in color and appears to not be in any pain. Mom, have you ever heard your baby cry aggressively? No, you haven't? Okay, cool. That's a good sign that he's not in any active pain. I'm also gonna check his weight. It's 7.5 pounds. Then I'm also gonna measure his length. It's 46 centimeters, which is appropriate for their age. Now I'm gonna measure his head circumference. That's 35 centimeters, which is also normal. And I see that the head shape is normal and round. And I'm going to check for posterior and anterior fontanelles. They're soft and slightly open, and I can also feel the coronal and sagittal sutures. I see that he has a little bit of hair, which is completely normal as well. The face is also symmetrical, and the eyes are aligned with each other. I also saw on the chart that he passed his hearing test, which took place about an hour ago. The lips are also pink and moisturized. And just taking a look at the baby, I can also see that the nostrils are clear of any discharge and there is no nasal flaring, which means there's no respiratory distress. I'll also check for the sucking reflex later. I don't see any signs of neck wobbling, and I also see the neck has full range of motion. I'm also going to go ahead and feel his clavicles. They feel well formed and there's no fractures, which is a really good sign. I'm also going to go ahead and check the heart, lungs, and abdomen sounds. Check the heart sound first. Check the lung sounds. Then the abdomen. Okay, so everything sounds normal. In the heart, I don't hear any murmurs. The lung sounds are clear and the bowel sounds are normal active. And also when she's breathing, I can see that when he's breathing, I can see that the thorax is moving symmetrically and the chest is rising equally, meaning that the lungs are working really, really well. I also saw that she passed her critical congenital heart disease test and the pulse oximetry test. I'm also going to measure his chest, 31 centimeters, and the abdomen, which is 34 centimeters. The abdomen is also round and full, and there are normal active bowel sounds, which I heard earlier. I'm also going to take a look at the umbilicus. It's clean and dry, and I'm also going to flip him over to assess the back. Okay, so on the back, the spine looks well formed. I'm not seeing any dimples at the bottom. All right, now I'm going to go and check the reflexes. So first, I'm going to check the Moro reflex. So I'm going to pick him up a little bit, and he startles. I'm also going to turn his head slightly to one way and see that he extends his arm, so he has a positive tonic neck reflex. I'm also going to touch his cheek. Rooting reflex is positive. He moved over to start to suck my thumb. He grasped my finger, which is positive grasp reflex, and I'm going to check the Babinski. Yep, the toes splayed out. Okay, so I'm also going to take this diaper off and take a look at the genitals to make sure everything's okay. Okay, so the penis and testicles look normal. The diaper is also clean, which is nice, so I don't have to change it. The anus also looks normal. Mom, when did your baby have their last stool? They peed and pooed about 2 hours ago? Okay, cool. So I'll be back to check later and see if they've had any more bowel movements, all right? And I also see that you breastfeed her 9 to 10 times a day, right? Okay, yeah, so that's how much you did for your last child, but so far you've only breastfed about 5 times today. All right, that's cool. Yeah, well, your baby's gonna be sleeping a lot, about 15 to 18 hours a day, and they're gonna be waking up every few hours to feed. Okay. Are you able to comfort her when she's crying, just by when he's crying by holding him? Yes, you are. Okay, cool. Well, I'm all done with my assessment. I'm just gonna go ahead and swaddle up the baby again. Yeah, your baby's looking good. The assessment showed no bad signs, and so far he's looking really healthy, okay? Do you have any questions for me? No? Do you need anything? No? Okay, well, if you do, you have your call bell. You can go ahead and press it, and I'll come over, okay? All right, you have a nice rest of your day. I'll be back soon. Bye-bye.